Now to talk about ischium, we will start from the anatomical position. This was the anatomical position, and this lower part, all of it is the ischium. This ischium is the bone that forms the postero-inferior part of the hip bone. Now if we look at it here, this is the ilium, this is the pubis anteroinferiorly, and this part which is held in my hand, I'm holding in my hand, is the ischium. Alright, and it forms the posterior-inferior part of the hip bone and also the adjoining 2/5 of the acetabulum. So the acetabulum is formed by 2/5 ilium, 2/5 ischium, and 1/5 by the pubic bone. Now this ischium, it has a body and a ramus that we talked about with the pubis. Now the body of the ischium. This body of the ischium is thick and massive, and it lies below and behind the acetabulum. This is the acetabulum and the body of the ischium, all of this part is the body of the ischium. It lies below and behind the acetabulum. It has two ends, an upper end and a lower end, and it has three borders: anterior border, posterior border, this one, and the lateral border. And it has three surfaces: the femoral surface, this one. It has a dorsal surface which will be in contact with the gluteal surface, and a pelvic surface. We'll talk about them in detail. First of all, the upper end. The upper end of the ischium forms the posterior-inferior part of the 2/5 of the acetabulum. This part, this is the upper end of the ischium. So the acetabulum now is formed by these three bones: the ilium, the pubis, and the ischium. The upper part is forming the upper 2/3 of the acetabulum, 2/5 part of the acetabulum. Then the lower end, it forms a tuberosity, all of this part, which is called the ischial tuberosity. Upper part forms the 2/5 of the acetabulum, lower part forms the ischial tuberosity. The anterior border forms, this is the anterior border. Why we are calling it anterior border? Because in anatomical position, this is the position of ischium. So this part becomes the anterior part, and this one is going to become the posterior part, or posterior border of the ischium. So the anterior border is going to form the posterior margin of obturator foramen. The posterior border, this part, is continuous with the posterior border of the ilium. This was the posterior border of ilium, which had the greater sciatic notch. The posterior border of the ischium is continuous with the posterior border of the ilium. This posterior border continues above with the greater sciatic notch, and it forms the lower border of the greater sciatic notch. This lower border of the greater sciatic notch ends at a projection, a spine-like projection, which is not present in this bone, and that spine-like projection is called ischial spine. After the ischial spine, there is another notch in the posterior border, and this notch is called the lesser sciatic notch. The lateral border forms the lateral margin of the ischial tuberosity. This whole structure is the ischial tuberosity, and the lateral margin of the ischial tuberosity is the lateral border of the ischium. Then there is the pelvic surface. This pelvic surface is smooth. It forms the lower part of the true pelvis. There are two other surfaces. The dorsal surface is continuous. This part is the dorsal surface, which is continuous with the gluteal surface or the posterior surface of the ilium. In its upper part, it is convex to house the convexity of the acetabulum. Then it has a shallow groove, and it continues with the ischial tuberosity. The femoral surface is this part, which is going to be present between the anterior and the lateral borders. This is the lateral border and anterior border. This part is the femoral surface because it is present towards the femur. This here it is going to be the femur now. So This is the femoral surface. Now, if we talk about the ischial tuberosity, all of this part is the ischial tuberosity. It is a rough part that is going to bear the weight when the person is sitting. This is the part that sits on any surface. This ischial tuberosity is divided by a horizontal ridge into an upper part and a lower area. This upper area is further divided by a oblique ridge into a supralateral and an infromedial parts. The lower area is further divided by a longitudinal ridge into an outer and an inner part. Now, if we talk about the ramus, this is the ischial ramus. The ischial ramus joins with the lower ramus of the pubis to form a conjoined ischiopubic ramus. This ramus has two borders. Now again with the anatomical position, this was the anatomical position, so it has two borders. It has an upper border and a lower border. The upper border forms part of the obturator foramen. The lower border forms the pubic arch when combined with the other bone. Then it has two surfaces, the inner surface and the outer surface. Both of these surfaces are almost smooth, with the inner border being divided into three areas by two ridges. Now, if we talk about the attachments on the ischium, we will talk about the ischial spine. This ischial spine gives attachment to the sacrospinous ligament along its margins. Their margins, they are going to give the attachment to sacrospinous ligament. Then it also provides origin to levator ani, its posterior fibers. It also is related with the internal pudendal vessels and nerve to obturator internus. The lesser sciatic notch, which was this part. The lesser sciatic notch is occupied by the tendon of obturator internus. The obturator internus takes its origin from the margins of the obturator foramen, and then it passes through this part. It has a bursa deep to it to prevent friction. This notch is also lined by hyaline cartilage. The upper and the lower margins of this notch, they give origin to superior and inferior gemelli. The femoral surface, this surface, it gives origin to obturator externus along the margin of the obturator foramen and quadratus femoris along the lateral border or the upper part of the ischial tuberosity. Two muscles, the obturator externus and the quadratus femoris. The dorsal surface, which had the convexity and the shallow groove. The convexity is related to piriformis, sciatic nerve and nerve to quadratus femoris. This groove transmits the obturator internus muscle tendon. The ischial tuberosity has the following attachments. The supralateral area gives origin to semimembranosus. The infromedial area gives origin to semitendinosus and long head of biceps femoris. The outer lower area gives origin to the adductor magnus, and the inner lower area has the fat which supports the body weight in sitting position. Now, the lateral border of the ischial tuberosity, this part, gives attachment to the ischiofemoral ligament. The greater part of the pelvic surface, it is taken up by the obturator internus, and the lower end of the surface forms the lateral wall of the ischiorectal fossa, obturator internus, and the lateral wall of the ischiorectal fossa. The attachment on the conjoint tendon of the pubis are: the upper border has the attachment of obturator membrane, the border. The lower border provides attachment to the fascia lata, this border that forms the pubic arch. It gets the attachment of fascia lata and the membranous part of the superficial fascia. The muscles originating from the outer surface, this part, are the obturator externus near the obturator margin, then the adductor brevis, they are getting continued from the pubis, the body of the pubis, obturator brevis, adductor brevis, and then gracilis. These are all present on the pubic part of the ramus. Then the adductor magnus is almost present chiefly on the ischial part of the ramus. The inner surface has the attachments. The upper ridge gives attachment to the urogenital diaphragm. The lower ridge gives attachment to the perineal membrane. The upper area has the obturator internus. The middle area gives origin to the sphincter urethrae for the urethra and the deep transverse perineum, and is related to dorsal nerve of penis. The lower area gives attachment to the crux of the penis and origin to ischiocavernosus and superficial perineal muscles. Now let us talk about the acetabulum. This acetabulum, as we said, is formed by all of these bones, the ilium, the pubis, and the ischium. The upper 2/5 of the acetabulum is formed by the ilium, 1/5 is formed by the pubis, and the posterior-inferior 2/5 are formed by the ischium. This acetabulum is a deep cup-shaped hemisphere which is present on the lateral aspect of the hip bone. Now again, if we are looking at it from the anterior aspect, with the anterior superior iliac spine and the pubic tubercle visible, we can see that it is directed downwards, laterally, and forwards. The margins of the acetabulum are deficient inferiorly, where it forms a notch. This notch is called acetabular notch. It is bridged by a transverse ligament. There are two parts of the acetabulum: the deep non-articular part, which is also called the acetabular fossa, and it is filled with mass of fat, and that fat is lined by the synovial membrane, and a horseshoe-shaped articular surface, which is also called lunate surface, and it is present on the anterior, superior, and posterior aspects of the acetabulum. All of this surface is lined with hyaline cartilage, and it is covered by a fibrocartilaginous acetabular labrum to give it its depth. This acetabulum articulates with the head of the femur. Now coming towards the obturator foramen, this obturator foramen gets its margins from two bones. It is present between the pubis and the ischium. It is almost oval and very large in males, and it is triangular and small in females. This obturator foramen is closed by the obturator membrane that is attached on all of its margins except for this upper part, which formed the obturator groove, and this part allows the passage of obturator vessels and nerves to pass out of the pelvis. Thank you.